some of the level of higher level preparedness that we've put in place, and just to continue to assure him that the state will continue to do the very best to ensure that the state is ready, and I'm sure that this will be over us very, very soon. And to thank him for the support. Up until last night, all of the cases in terms of tests that we've conducted have been negative. They're still running some tests as we speak, right, on some other cases. So we'll see how it goes. But the bottom line is that we certainly should not allow anything to drop off. Our monitoring. That's really what we should ensure.
Welcome back. Well, health authorities at the Center for Disease Control say that there are now more than 500 cases of the novel coronavirus in the U.S. There are reports of 442 cases in 33 states and the District of Columbia, bringing the total number of coronavirus cases to 512. But in the meantime, no fewer than 133 people have died in just one day from the virus in Italy. And that raises the total number of those killed by the disease in the country to 366. Now, the jump in figures comes as millions of people adapt to new measures announced by the Italian government on their movement and travel in order to curb the spread of the virus. Well, we're joined this morning, as you may have seen in our welcoming slide, by Dr. Chidimga Ohazuruke, who is a public health physician. Good morning, and thank you for joining us today.
Good morning, and thanks for having me.
Oh, by the way, happy International Women's Day. I hope you're not letting this coronavirus conversation spoil your day, your celebrations, or what you had to do.
No, not at all.
Well, incidentally, there's been a lot of search on Google. People want to know, they're asking questions. But I think it's a good thing that they're even asking questions, no matter how the questions or what the questions are. But it's better for them to know, than to just go ahead. But in terms of the awareness of how telling people about the nature of this virus, what they need to do, can you rank or rate the kind of awareness or what people know, how we're responding to this? Locally, first and foremost.
Okay, I would like to start by, I think we're doing very well in making people aware of coronavirus even before it came into Nigeria. I think Association of Public Health Physicians of Nigeria has been all over television stations, all over radio stations, making that awareness get to the grassroots. At the level of the local governments, the medical officers of health of Lagos, I'm aware, are working with their health educators, their information departments, to make sure that this information gets to the grassroots in their various communities. So I think the awareness is quite high. But what is actually happening is misinformation. So what we're tackling with is misinformation and rumors that are being spread by social media. And Federal Ministry of Health, the Lagos State Ministry of Health, NCDC, everyone is putting out tweets and information on their handles that people can assess.
What kind of rumors are we dealing with?
I'm sure you're aware that we've heard rumors of there being a cure somewhere. There have been rumors of eating garlic, taking your bath with salt water and things like that. Things that are really not founded on science or evidence-based medicine. And so we want to tell people, and it's natural. There's what you call, I wouldn't say it's natural, but it's part of an epidemic cycle. So there's what we call infodemics. That's the epidemics of rumors. So with epidemics comes rumors. So it's like a natural, something that happens within an epidemic cycle. But health authorities are charged with that power to continue to give information, to be in front of the rumors rather than behind. And I think NCDC is really working hard on that.
Usually when people want to get information, this climate, they go online and they go to Google. And recently we worked with Google to get the top 20 questions that people ask about coronavirus. And it will interest you that people are asking, what kills coronavirus? That's a big question. So let's even start from there. What kills coronavirus?
So what kills coronavirus is very simple. You wash your hands. Soap. soap and then a chlorine solution. So if you disinfect, because it can get onto surfaces, if you disinfect your surface, the surfaces around you, your door handles with a mixture of water and chlorine, which is found in bleach, household bleach, that will remove it, that will kill it. Then just the mere motion of washing your hands with soap disrupts wherever it is that the virus is on your hands. So those are the things that kill the virus.
That's before infection.
Prevention.
That's before infection.
So after infection, is there anything that kills coronavirus?
No, for now, we are hopeful that we'll get cures for coronavirus, but what we have now at best is supportive treatment. So whatever symptoms someone who is infected with the virus have, those symptoms would have to be treated.
Beyond the rumors, what kind of responses do you think people are having, about this? How do you see people responding to the information, misinformation, disinformation around concerning this growing outbreak?
I think what's actually happening is people are acting out of panic, and that is why we will continue to give the right information. So panic is making people wear masks when they're not supposed to wear masks. And that is why we're here to give that information, that if you're not sick, if you're not coughing, if you're not taking care of someone who is ill, then you don't need a mask. You're actually putting yourself in more harm.
They've already bought the mask.
That's on the one hand. On the other hand, the way public transport is, and most of the places where people commute find themselves, heavily packed bus stops, heavily packed buses, tight packed cars and stuff like that. It's difficult to convince people not to do that.
But for where we are now as a country, I think we're still living our normal lives. Hopefully we'll not get to the point where Italy is now, where it has to shut down a city of 16 million people. For now, I think France has a caveat that the people in public gatherings that have more than 5,000 people cannot hold. For now, there's what we call community transmission, and that is when this virus starts moving from being transmitted from one person to another in communities, which is what the US is facing at the moment. Nigeria is not at that level yet. Maybe, but we hope we don't get there. When we get there, we'll now start thinking about whether we should gather publicly, whether we should use public transport. But it's something we just have to watch and wait.
Let me just refer to those questions again. I looked through them and they were quite interesting. One of them was, what does the coronavirus look like? And, I see this. Does this look as cute as this? I mean, this looks good, honestly.
Yes, on electron microscopy, that is how it looks. Yeah. Obviously, you can't see it. Viruses are so tiny, you can't see it with your naked eye. So even if it's on your hands, you can't see it. But on electron microscopy, so you can see like the crowns on a crown shooting out. Those
Which
spikes,
is why it's called corona.
That is why it's called corona, from crown, really.
So the question is now, a lot of people want to find out these things. Now, how does it help people having this sort of information? For example, what it looks like. I mean, an average person, questions like, how does it look like? How can you identify it? Does that really help you?
I don't think it helps for the lay public, because you're never going to see it with your naked eyes. And electron microscopes are not things that you find easily. So except you get a sample of the virus and put it on an electron microscope, you're not going to see it in this way. But what is important is three things. Be safe. So be safe by washing your hands using alcohol hand rub. Be smart by getting the right information. So for Nigeria, we've talked about places where the handles where you can get the right information. The Federal Ministry of Health, the Lagos State Ministry of Health, the NCDC. Those are the places that you can get the right information. And then be kind. Don't stigmatize. Don't panic. So those are the things. So those we should be looking at people rephrasing their questions to ask. So what can I do to keep myself safe? How can I get more information? And how can I help someone who I know? Because you can also refer someone who you know is sick, someone you know is coughing. You can point the person towards the right direction of where to seek.
But it's also good to know that as of the 7th of March, there's no new confirmed case in Nigeria. We understand that a total of 23 suspected cases, I think there were 2 new ones. They were identified in 5 states, Edo, Lagos, Ogun, FCT, and Kano, out of which 1 was confirmed positive. That's an index case, but there's no death. A total of 219 contacts were made. They were identified, rather, including contacts from the hotel, the workplace, and healthcare workers. No new contacts have been reported in Lagos and Ogun. So the confirmed case is clinically stable at the designated treatment facility for COVID-19 at the Infectious Disease Hospital that's in Yaba. So they say that there's this multi-sectoral National Emergency Operations Center activated at level 3. It continues to coordinate the national response activity. So this is the information that we've got from the NCDC. But then, people also ask, there's this talk about how does it spread? How can it be contracted?
Okay, so it's basically spread by what we call droplet infection. So someone who is infected with the virus, who is coughing or who is sneezing, So when the person sneezes and the droplet of that cough gets to some other person, that is when you then maybe it gets to your hand, and then from your hand you touch any of your eyes, your nose, or your mouth, then you get infected. And that is why one of the things we're asking people for is what we call social distancing. So if someone is coughing, if someone is sneezing, just maintain like a 3 feet distance or 1 meter apart from the person, so that the droplets don't fall into you.
And not that, so as a result of that, they then ask, can they say it's airborne?
It's not airborne because it's not from the air, but it's from a droplet. So when someone is sneezing and, the force of the sneeze can actually bring out some droplets from the person's mouth, and then it lands on someone else.
So that means, yes, if the person who has it coughs, it's not that the air just,
it's not in the air.
No,
it's not in
the
the
droplet, if it touches you.
Yeah. Or it touches the surface,
and then you touch it,
the
and then you
maybe you get your hands into your eyes, your nose.
Then you can contract it.
There is also the question of what's the lifespan of a virus that has not gotten on any human being?
Maybe if it's on the surface?
That means it's on the surface, how potent or risky is it for anyone to touch a surface where an infected person has
Okay, so the evidence about that is evolving. The information about that is evolving. Some people have said 9 hours to 24 hours. But how long it lasts is not important than what we should do. So what we're asking people as public health physicians to do is promote action on your part. Clean your surface regularly. Clean your door handles. So just clean, because we don't know. An emerging disease, which what coronavirus is, an emerging disease is a disease that you don't really know so much about it. It's evolving. So the information about the disease is also evolving. So instead of us asking how long it can last on the surface, we should promote actions by arming ourselves with just cleaning our surfaces as often as we can.
The kind of information that goes out now from the rumors and everything that you're talking about, it also begs the question: what kind of information gets to the rural areas? How are we, or can we handle that?
And there are people who are skilled in health communications. So there is a part of public health that is health communications, and so these people know how to break down a message into indigenous languages, craft it in such a way that it reaches people, and then they have the channels of disseminations in local governments in words and how they get to the populations that they need. So it's health communications at this point is something that it's crafted, and it's already going on in the local governments, at least.
How well are we doing about that, if you don't mind me asking?
They are, because I know that all the medical officers of health, who are the medical officers in charge of health for all the local governments in Lagos State, have meetings. They are working, just as you talked about, multi-sectoral approach at the federal level. Even at the local government level, there are teams, there are multi-sectoral teams that have to do with people from the information arm of the local government who are adapting these messages and pushing these messages into communities as fast as they can.
When you see figures about the fatality rate across the world, I mean, in Italy, for example, over 133 people dying in a single day.
Yeah.
And I'm sure a lot of people see those figures, and which is probably why they asked this question: how does coronavirus kill? There's been a lot of talk about it affecting people that are elderly, or people that are very young, or people with chronic illnesses. But how does it progress to that point?
Okay, so it starts with the simple symptoms of a cough, a fever, and a general feeling of unwell. But this virus attaches to the lungs. So when it gets into the lung and attaches to the lung, So if the person has an underlying infection, the immunity is not very strong, then it can suppress the lung function, and the person gets into what we call a respiratory distress, and then can now have lung failure and die from them. Sometimes it can cause kidney failure. So so it's when it actually becomes complicated. And that is why some people will have the mild form of the infection and some people will have the severe form of infection. 80% of the people who get infected actually have the mild forms of the infection and will recover from the infection. What is important is getting to a healthcare facility as fast as possible in the early stages, of the disease, so that you can stop it becoming complicated as the disease progresses.
All right, let's toss to Abuja. Marquez got some questions for you. Marquez, go ahead.
Well, we see just how the disease is spreading in other parts of the world, and we see that almost a new case is reported in countries that did not have it before now. Considering just what we're seeing, especially in places like Europe, Italy more specifically, where we now have a whole region quarantined, I think about 16 million people, how at risk is Nigeria? And do you think that by now we should have travel restrictions from certain parts of the world?
I think Nigeria is strictly following the WHO guidelines, and WHO has not asked for travel restrictions for any country. But I'm sure that the authorities, the NCDC, the Federal Ministry of Health, are watching the situation. As I said, it's something that is evolving. And I want to believe that they're taking decisions that are best suited for our country at this time. If at any point we need to initiate those measures, I'm sure they'll be ready to do that. But what is, as I said initially, is that these countries have what we call community transmission. For now, we don't have that. For now, we don't know what is going to happen in another 1 hour, in another 1 day, in another 1 week. But for now, we don't have community transmissions. Especially a city like Lagos with 22 million people. If that happens, we want to believe that we have the manpower, we have the necessary resources to be able to contain. Remember, when we talk about cities or countries where it's spreading, there are some countries that have contained this thing. Vietnam has contained it very well. They had only one case, Egypt had only one case, and they've not had anyone. So while we talk about where it's spreading, there are some people just like us, there are some countries just like us that have had just one case, and after that one case, they've not had any other cases.
Because, I don't know if Egypt has recorded one death, but for those countries that is just spreading so fast like that, and then I think they say there's a Nigerian who had contracted, I think it was in D.C. before he moved to, was it Maryland? And then he contacted us. So what is it about regions now? Is there any new information about why or it's not spreading that fast in some climes as opposed to some other climes here, for instance?
Again, the evidence about that is evolving. It's not stated. There's some scientists have talked about the virus multiplying at a region of 8 degrees centigrade, which most tropical countries like Nigerians, we don't get that kind of low temperatures. But that doesn't mean we can't stick out our necks to say that it's not transmitted in higher temperatures. They're also looking at it getting better when the temperatures become warmer in colder climates. But all these are, researches that are ongoing. As I said, it's a disease that is evolving, and the information about it just keeps evolving.
So when this started, or before this started, I think I recall the DG of NAFDAC saying that there's perhaps a tendency for us to have a drug crisis, drug insecurity in the country, and it brought a major concern because we get supplies from China, for example. Yeah, we get from India too, but also from China. But I'd like to talk about the cure first before we talk about the security part. Now, I understand that a certain organization in the country said they developed a cure for this coronavirus, and people are expecting, that was about a week ago, people are expecting, when are we going to hear if this is true or not? So what's the process of confirming whether a cure is indeed a cure, and when would you start using that cure?
So a cure for coronavirus will take some time, whether it be a drug or a vaccine, because there's what we call clinical trials, and has 4 phases of clinical trials. So finding a cure would just be the first phase of it. So it has to go through phase 1, phase 2, phase 3 before it goes to the market. It's at phase 4 that it's openly available to everybody in the open market. So it's a rigorous scientific process. So even if there is a cure today, it probably will take up to a year for it to get to the open market.
All right, then we do thank you for coming on. Dr. Chidumga Ohazuki is a public health physician. Thank you for your time this morning. All right, so there you go. We'll be back in just a moment. Stay with us.